My name is Schaffer, and I practice sleep medicine and obesity medicine and metabolic health at the St. Peter's Sleep Center. I'm able to provide services regarding sleep. I'm able to provide services regarding diabetes, metabolic health, obesity to my patients. I really see obesity as a metabolic disease, really, as opposed to what we see on the surface, which is being overweight and having trouble carrying ourselves maybe. And of course, the link of obesity and sleep apnea is a natural. And sleep apnea is basically a mechanical disorder. There are metabolic effects, but it results in having too narrow an upper airway. And the most common cause of that is having excess fatty tissue, excess adipose tissue. Because when you have excess belly fat, you tend to have excess fat in the sides of the throat and the back of the tongue, and these things narrow the airway. So it's a very common correlation. So being overweight or obese increases your risk for sleep apnea. So when that happens, you're trying to breathe, you can't, your oxygen goes down eventually, you wake up so you can breathe, usually just for a couple of seconds though, and you'll fall right back to sleep, not remembering it the next morning. So when that happens, you're trying to breathe, you can't, your oxygen goes down eventually, you wake up so you can breathe, usually just for a couple of seconds though, and you'll fall right back to sleep, not remembering it the next morning. Just not getting enough sleep increases your insulin resistance. Not getting enough sleep increases your level of inflammation. Both of those things will increase your coronary disease risk. It's also been linked to irregular heartbeats and congestive heart failure, coronary artery disease by the inflammation and blockage, even cardiac arrest. So what I do is I talk to them about their sleep issues, and we do the sleep study if it's required, and usually get them on their CPAP machine, the breathing machine that we use for sleep apnea. That first night on your CPAP, where all of a sudden you sleep through the night, oh my gosh. It's truly like being reborn. It's what I'm about, is reaching people and helping them. And the best way I feel like I can do that is through sleep, through weight, but also work with them. I'm here to help. Would you like to work with me? Okay, and that's a very big difference than the typical you need to lose weight. Because you need to lose weight means you, the patient, are the problem. And this is a patient who is struggling with weight for all their lives, where society, their friends, their family, their work, and just the air in general has basically put them down. And that's just not okay. To see the eyes of a patient who has a sense of hope is just wonderful.